Hey guys, today I'm gonna be going through hyperkalemia. At the end of the video, we have a little quiz as well. So watch the video so that you can answer each of them. Let's start with the definition. Hyperkalemia means high levels of potassium in the blood. What's the normal potassium level in the blood? 3.5 to 5 millimole per liter. This is the normal level. But when we can say this is hyperkalemia, if the level of the potassium is more than 5.5 millimole per liter, then it is called as hyperkalemia. How does the high levels of potassium manifests? The symptoms could be abdominal pain, chest pain, nausea, vomiting, muscle weakness, heart palpitation and arrhythmias. Why heart palpitation and arrhythmias? Because too much of potassium in the blood can damage the heart and that can cause a heart attack. But it will cause a heart attack only if the level of the potassium is more than 6.5. More than 5.5 is hyperkalemia, but between 5.5 to 6.5 we have other symptoms like this. But if potassium level reaches more than 6.5, it will lead you to the symptoms of heart palpitation and arrhythmias because the heart is getting disturbed, heart is getting damaged. Normally, whatever we eat, whatever we drink, the kidney filters the potassium out of that. But let's say if the kidneys are not working properly, or due to any diet which is containing high level of potassium, or let's say any drugs which are potassium containing drugs. So if the patient is taking that, the kidneys are not able to filter that. In that case, the potassium will build up in the body and kidneys will not be able to filter that out. To diagnose it, we can do a serum potassium test that will tell us the level of potassium in the blood, and we can do an EKG. So let's see what are the changes in the ECG due to hyperkalemia. The first change we have is tall peaked T wave. So let's say this is P wave and then normal QRS complex, then tall peaked T wave. Okay, and then again P wave, QRS, and then tall peaked T wave. These peak T waves occurs when the level of potassium is between 5.5 to 6.5 millimole per liter. Second change that comes is loss of P waves. So it will show us like direct the line, the QRS complex, tall T wave, then again QRS complex and tall T wave. So loss of P waves. We don't have any P wave in the ECG. Next is widened QRS. So this loss of P waves occurs when the level of potassium is between 6.5 to 7.5. Widened QRS will occur when the level of potassium is between 7 to 8, and the ECG will be something like this. Everything is widened. So the QRS is widened, then T wave, then widened QRS, and then T wave, and this is all. Next is sine wave pattern when the level of potassium goes more than 8. In that case, this sine wave pattern will appear, and this shows us like this one. So now we know if it's hyperkalemia, the T wave will show something like this. It's tall and peaked. But if it's hypokalemia, in that case the T wave inversion will occur, and that's why the U wave will look prominent. Due to that, the Q and U, this is U, right? So the QU interval will increase. So the increase in QU interval, it only appears in hypokalemia. To treat the hyperkalemia, we have three ways. First is immediate antagonism. So what we use for the antagonism, we use IV calcium. So calcium is antagonist to the potassium. How much we give? 10 ml, we give 10% of calcium within 2 to 3 minutes. So calcium increases in the blood and it will decrease the potassium because they are antagonists to each other. Next is rapid reduction by the redistribution into the cells. How will we do that? We have some agents like IV insulin, IV bicarbonates, and beta 2 agonists. So we'll use these agents and we will redistribute into the cell so that it will decrease the level of the potassium into the blood. or we can remove the potassium from the blood. How we do that? We use the diuretics, we can do the dialysis, and we can use the cation exchangers. So now you know almost everything about hyperkalemia. Let's answer some questions and let's revise it. First question is normal potassium range in the blood. So is it 3 to 4? Is it 2 to 6? Is it 3 to 3.5 to 5? Is it 5 to 7? Now we all know it's 3.5 to 5. Second question is major complication of hyperkalemia is liver failure, acute pancreatitis, hypotension, or heart attack. It's heart attack because whenever the potassium level goes more than 6.5 millimole per liter, in that case it can damage to the heart and it can cause you the heart attack. Third question is most serious ECG pattern of hyperkalemia. So the first option is widened QRS. Of course it happens, but it happens whenever the level of potassium is between 7 to 8. Narrow QRS will not happen in the hyperkalemia. Sine wave pattern occurs when the level of potassium is more than 8. Inverse T wave is not a sign of hyperkalemia, it's the sign of hypokalemia. So now we have two options left, widened QRS and the sine wave. So more severe is the sine wave because it increases when the potassium increases more than 8 millimole per liter. In that case sine wave pattern will appear, and that's most severest form of the hyperkalemia. Fourth question is hyperkalemia is potassium level more than 2.5, more than 3, more than 4, more than 5.5. It's more than 5.5. Fifth question, which of these can protect the heart from the hyperkalemia? IV calcium, IV insulin, IV bicarbonates, oral thiazides. See, oral thiazide is a diuretic that we can use to remove the potassium from the blood. IV bicarbonates and IV insulin, these two things we use to redistribute the potassium into the cells. IV calcium we use as an antagonistic agent to the potassium that will decrease the level of potassium in the blood because this is the antagonist. So, and this is the only thing which protects the heart from the hyperkalemia effects. So the answer is IV calcium. Sixth question is in hyperkalemia dialysis is indicated as first line treatment. No, the first line treatment should be the IV calcium. If potassium is more than 6.5, no, in that case also we can use these things. Next option is when other measures don't work. As the last option we use the dialysis. Yes, it's right, correct answer, because whenever we have the hyperkalemia we use first of all the calcium, we try the insulin, we will try the beta 2 agonists, we will try bicarbonates, but the dialysis is the end option, like the last option. When nothing is working, in that case we should use the dialysis. Dialysis is not indicated, no, it's absolute indication in the hyperkalemia. It's in every guideline it's written. So this was all about it. See you in the next one.